25 minutes past 7, good to have you with us this morning. So social care bosses have told Good Morning Britain that the sector is on its knees with staff shortages at the highest since records began.
Incentives like shopping vouchers are now being given to carers to encourage them to stay. Here's Emily Manick.
Karina and Charlotte spend their days looking after people like Susan, who needs full-time care after having a stroke.
They do too much, I think. I don't know what to do without them.
Care sector bosses have told Good Morning Britain that they are facing a staffing emergency with 165,000 vacant posts in the sector. That's 10% of their whole workforce.
We want people to come here and want them to see what a lovely job it is, and, you know, it's like having a second family, but when you see the advertisements next to each other with more money, especially with the cost of living, people will opt for the job with more money.
Some providers are now handing out shopping vouchers to incentivise carers to stay. Earlier this month, the government announced plans to spend £200 million to buy up thousands of extra beds in care homes and free up the burden on the NHS. But critics say that this is only a short-term solution.
We started discussing in September. We still haven't seen that money come to the front line yet, and we should be really planning for next winter.
Carer Karina is encouraging the Prime Minister to come and see what they do.
He can come and work a day in care just to see how it is, how challenging it is, how hard it is sometimes, and the impact to the mental health.
Social care bosses say without proper funding, the situation is only going to get worse.
Well, we're joined now by Mike Padgham, who you saw in that report, the owner of St Cecilia's Care Group and also chair of the Independent Care Group, and Shaun, who is the health editor for the Sunday Times. Good morning to you both. Mike, if we can start with you, just explain from your perspective, you're on the front line with this, of course, having a number of care homes in your group. How bad is the situation right now?
Good morning, Ben. Well, from my perspective, I've been in the sector now more than 30 years, and it's the worst I've known it. We look after 137 people, and we're very short of staff. We've got about a 10% vacancy ourselves, and we have to provide that care 24/7. And recruiting is becoming much, much tougher. So we're doing all these things to try and attract new people in. But basically, there's not enough funding in social care. Local authorities aren't funded enough to be able to pay what it costs us to deliver the care. So that's the main problem.
The government's saying that they're going to spend £200 million to buy up beds. Because, of course, they've got a real issue with hospitals at the moment and A&E and bed blocking. Is that money that could be better spent elsewhere? Is that money going to make a difference for you?
Well, we welcome the money, but obviously, as was said in the earlier piece, in our view, it's a sticking plaster because if you take what the Chancellor said when he's at a different post only in the summer last year, social care needed £7 billion. That's £7 billion just to stand still. So the money we're getting, 500 from last year and 200 million this year, will help, but it doesn't go far enough. It's not a shortage of beds that we've got, it's a shortage of staff. And it's not the highest paid job in the world. Although we do pay more than the national living wage, it's still not enough. In my view, carers should be on around about £15 an hour, on a par with the NHS. But we cannot afford to do that. And we just have to make a profit to be registered with CQC, that's the Care Quality Commission. So we're between a rock and a hard place. We want more people in social care, but at the moment, in retail and other areas, people are paid more.
Mike, I mean, there's two things I wanted to raise with you. One, of course, is that putting in money for beds in homes doesn't solve the wider problem of social care anyway, does it? Because you do a fantastic job with your homes, and the people that work in care homes do an incredible job. But actually, social care is about more than that. It's about in individuals' homes. So it just frees up one section and doesn't look at the wider picture. But also, there's lots of accusations anecdotally from people who feel, in a way, that the groups that run homes and indeed the groups that run agencies could have more freedom to pay their staff for, and that they are, maybe it's a hangover for when people did make a lot of money out of care homes, that it's a hangover that they're, in a sense, making money out of it, to put it bluntly, and not passing it on to those who are getting work. Can you just address that for people?
Yes, Kate, I'll do my best. I think the issue is, of course, yes, you think about in the past, there were, in the 70s and 80s, perhaps people thought it was a licence to print money. But nowadays, the majority of providers are small family-run organisations who are doing their best to deliver care. Quite rightly, care staff need to be paid more, but the costs we're getting from local authorities across England are not enough to keep pace with the type of people we're looking after in terms of the costs of running the homes. Of our 5 million turnover that we have in our small group, 3.6 million of that goes straight on staff wages. And to give you an idea, for every 10p an hour that we want to pay staff more, it costs us around 30,000. We've got to do something in this country to address the wider issue. Social care is underfunded. The reforms that we've been promised keep getting delayed. And it's not just this government, it's the Labour, the Coalition, the Conservatives have all ignored social care to their peril. The NHS and social care must work closely together. But I don't think this government has still got the message. If we're weak, we can't help the health service. And you mentioned about care in the community. Of course, beds aren't the only answer. We want people to be cared for in their own home first. The problem is there, we can't get enough staff to look after people in their own home. And we have to pay them more too. But if we spend more from the NHS into social care and prevention, we will eventually make it better. But it's always short-term with the politicians. They don't seem to understand prevention. Care in the community is what's going to help the health service in the long run. But we could keep putting money into beds in the NHS. And in my view, that's not the right way round.
It's not the solution. Very interesting. Shaun Lintern, this is a huge problem. It's not ever going to be a quick fix, is it? And successive governments have wanted to do more or said they wanted to do more and have not solved it. Are you clear on a solution?
Well, I think that's a big question, Kate, and I think Mike, when you listen to what Mike was saying, he spells out the problems he's facing. But what we know is that this is a nationwide systemic issue. It's affecting all sorts of care providers, as you say, both those in people's homes and in care homes. We've got 165,000 vacancies in social care, and that's the problem today. But we also know that 28% of the staff working are likely to retire in the next few years. So we've got this big problem coming down the line. And as a nation, we are getting older, living longer, but sicker. So we're not spending the last few years of our life in good health. So we all need these kinds of interventions, and it keeps being put in the too difficult pile.
We saw the carers, in the report there, both saying how challenging it is, but also saying how much they love their jobs. And if only they could show other people how much joy you would get from doing a job like that. There's challenges that there are. But equally, as one of them said, when you see the cost that we're getting paid and then you see it next to a job that comes with far less stress, that is getting more money, you can understand why people are going to drift towards those jobs, because there is so much involved with caring. Definitely.
I've been privileged to do shifts with care workers and out in the community with district nurses, and you know, I am neither smart enough nor compassionate enough to do that job, and I don't think we recognise that. We haven't professionalised these roles. So, you know, we're paying £10 an hour or etc. People can earn more than that, stacking shelves in Lidl and Aldi and elsewhere. And
perhaps have the less weight of the pressure when they leave their job and go home, because carers worry, you know, if they can only give 1 or 2 hours a day and they're covering a large area, say they're going to homes or doing long shifts in a care home, they worry when they go home about how stretched the staff are there, don't they? So it's very, very difficult. When we talk about this, we often sort of have in our mind, and you mentioned it there, an ageing population, but of course this problem isn't just about older people, is it? That's the thing, it's somebody could be walking across the road and get hit by a bus and need 24-hour care, and it doesn't feel as though we're really addressing it as the emergency in the way that we should be, as we would if it was an A&E department.
I completely agree. It's often not realised that a significant number of people needing care are actually working age people.
And could be paying taxes if they were supported and got back into work.
Absolutely. I think we've got a big issue of long-term ill health in society, which is holding us back as a country. And I think we just need to recognise that these systems, the NHS social care, how they connect and work together, that is, if we don't fix that problem and get it sorted, it's just been put in the too difficult pile for too long, and we need to fix that.
Oh, well, we probably haven't fixed it this morning, but we've had the conversation about it, which is a step forward.
We try and find an answer.
I love the idea of the Prime Minister doing a shift with a care worker.
Wouldn't that be great?
I think that would be great. I'd like to see that.
Well, you know, when you've got Simon Clarke, who's the Chief Secretary to the Treasury, suggesting that nurses on £35,000 a week using food banks aren't budgeting properly. You wonder how they would cope in that sort of scenario. Would he be able to do the job that they do as well?
He was asked directly, wasn't he, Rishi Sunak, about whether he could live on £18,000 a year, and he didn't answer that question, because it's a tough one to answer.
Shaun, thank you. Mike, thank you very much for joining us as well this morning.
Thank you.